We're back with Dr. Msonthi Levine to answer more of your medical questions. 65-year-old female says if someone has a fatty liver, but he or she exercises and eats right, will the fatty liver go away?
Typically, a canned fatty liver is just like anything. It's just fat in your body, and a lot of times we have fatty liver because we are overweight, so lifestyle has a lot to do with that. So certainly diet and exercise, weight loss will significantly help the fatty liver. Again, if the fatty liver is not treated long term, it can turn into cirrhosis, scarring of the liver, and that can cause a whole host of issues. So it is something that needs to be dealt with. It's another reason to get on board with your health.
So what causes a fatty liver to begin with?
Really just excessive fat. I mean, we have fat in our belly, fat in our skin. The fat goes into our abdominal tissues, and so it finds its way in the liver, but it causes inflammation. That's a lot of times why we find it, because we do routine blood work. The liver enzymes are mildly elevated. Doctor does an evaluation, normally a liver ultrasound and some other tests, and finds that the liver has fat in it. And so it's just a matter of weight loss. The fat finds places to go, and so that's the reason why.
But it still develops into cirrhosis. You automatically think cirrhosis and alcohol disease. It's not the same thing?
They're not the same thing. Cirrhosis is just scarring of the liver. That could be from any chronic insult to the liver, such as a viral infection like hepatitis. We know about that. Alcohol abuse, because that is a toxin to the liver as well. And fat is a toxin to the liver. It causes inflammation, and chronic inflammation is what causes disease and illness. Even the liver, one of the most toughest organs we have in our body, cannot defeat that chronic inflammation, and so it eventually will cause scarring of the liver, and so that will eventually cause cirrhosis. Now, this takes a long time. It's not something that happens in 5 or 10 years. You're talking about 20, 30 years. But certainly a lot of times, as you know, it's difficult to get your weight under control when it starts, and so that normally turns into 20, 30 years of being overweight, so it is serious.
But when we supersize every single day, that's what happens.
You know, you can maybe do that periodically. You know, it's not necessarily totally eliminating that comfort food. I like it. Everyone loves it. It's just not doing it every day, maybe splurging once a week.
Okay. A 67-year-old female, is there a surgery to get rid of permanent nerve damage in the shoulder?
Typically not. Permanent would mean that it's probably already damaged, and the nerve, just like the brain, does not do well when it is injured initially. Modern technology, medical community has not figured out a way to repair a lot of the nerves once it is damaged, once it is severed. Typically that is it. We're working on that, obviously, but we're not close where we need to be.
A 57-year-old male, will a couple of teaspoons of vinegar daily help him get rid of belly fat?
I think if he can do that and not eat the fries and the burgers and get outside and exercise, absolutely it will help. Okay,
a 61-year-old female, her doctor says she has arthritis in her right leg and she's been using a walker. What can be done about the pain?
A lot of times we have to do some x-rays, maybe try some blood work, maybe try some medications such as anti-inflammatory medications. There's good nerve medications such as Lyrica, Neurontin, Elavil that work really well. This person might need surgery, so just to make sure an evaluation is done and maybe place some medications that might be effective.
All right, Dr. Levine, as always, we appreciate you stopping by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kftm.com, or you can post those questions every Monday on our KFDM News Facebook page.